questions that are asked to a dentist commonly.
Hi everybody, we're here from Denver, Colorado, and we had a challenge today in one of our continuing ed groups where we had to do a Facebook Live. So we're going to be answering 3 top questions that we hear all the time from our patients. With me today is...
I'm Beth Herco from New Providence Dentistry.
I'm Christina Levitsky from Molecular Hill Family Dental.
I'm Dr. Kay from Mint Dental Franklin. We're also going to play a little game. We have the questions on a beach ball written down, so we're going to have it tossed around to us, and we're going to answer the different questions that we're getting. All right? Let's see what we got. All right. First question is, what's a good time to bring in your child? What do you think, guys?
So we recommend that you bring your child in about 6 months after they get their first tooth. I think a lot of parents expect the child to get a cleaning at 1, 1.5. That's usually not the case. Usually it's a lot more about education, talking about habits like staying away from juice, no bottles at bedtime, things like that. In my experience, I would say we can't really do a cleaning until 2 or 3. Most children probably won't do it before then.
Yeah.
But it's still good to bring them in, get used to the equipment, get used to the sounds. They get prizes and.
Yeah, Isaac likes prizes, right?
It's
When he goes in, yeah,
It's
exactly.
good to establish a home base,
Yeah.
too, so if anything injury happens, sometimes injuries happen with children, and if they've already been to the dentist, it's a little less scary. You
Sure.
can't, when they have an injury, then at least they know something about the surroundings and it's not all new to them.
Yeah, I think it's just getting them comfortable with a new place, and I know that going to the doctor can be scary, and that kind of looks like where they're going, and it can be a little intimidating. So making it fun, we try to put, movies and cartoons on for the kids and distracting them with toys, but mostly just letting the parents know things that they can be doing at home, because you're going to be doing more than we probably will. So it's kind of in your hands to make sure that the home care is as good as it can be. So that's one. Yeah?
Yeah.
All right, so let's see. Next question.
Okay, why is waiting until it hurts a bad idea? This is an interesting question that I get from a lot of patients. And the reason why waiting till it hurts is a bad idea is because everybody has a different level of pain. So some people can feel the smallest cavity, right? So they come in, they're like, my tooth is killing me. I look in their mouth. They have the teeniest, tiniest cavity happening there. And I'm like, really? This thing is hurting you? And I fix it and the pain goes away. Other people, they come in and there's basically nothing left of their tooth. And they're like, can you put a filling in this? It looks a little funny. And the tooth is long gone and the person never had pain. So waiting until it hurts is a really bad idea because it's not an indication for a problem in dentistry.
One of the things I like to also tell my patients is when you guys go to the doctor and you get your checkups, they check for something like cholesterol, right? And cholesterol doesn't hurt. Like our heart doesn't hurt when we get cholesterol buildup or other stuff. Just like a cavity, it doesn't always hurt until it's really, really big and bad. Sometimes, unlike, certain cases. So it's really good if we can catch it early. We can be more conservative with our treatment, less costly, less painful. So many other things that can go wrong the longer you wait until something hurts. So if you come in at least twice a year for your checkups, you get your teeth, x-rayed, and you get your cleanings, you make sure your gums are healthy. Those are super, super important. All right.
Okay, I'm
One
throwing
more.
it to you. Oh wait, it's your turn.
Well, it's all right. I'll answer the next one. Let's see what we get. All right. So what's the difference between a regular cleaning and a deep cleaning, since we're talking about coming different times of the year? So sometimes our gums are healthy enough for a regular cleaning, so they don't have as much buildup. You guys are doing a pretty good job at home of brushing and flossing, and we don't see the plaque and tartar buildup, and it's easy to clean. It's above your gums. Sometimes when it goes to months and years and decades, that plaque and tartar goes really, really deep under the gums, and it's not a straightforward thing. And it can hurt, and it can be one of those things where you notice your gums are bleeding a lot when you're at home, and you're like, what's going on? Those are usually signs that you might need a little bit more than just a regular cleaning, and you need to be numbed up sometimes for it because it's a little bit uncomfortable. And it also means you might have to come in more frequently for cleanings, because twice a year is just not going to cut it. And it depends on your diet, it depends on genetics, it depends on your home care, and depends on so many things. So the only way you can know which one is good for you is if you come see a dentist. Right, guys? Is there?
Yeah.
I mean, I don't know if there's anything else, but I know that patients will come in and like, can I just get a cleaning? And we don't want to upset you all and just say like yes or no, but we want to do what's best. So sometimes we have to do a little bit extra work to get you into a good, healthy situation and move you back to those regular, simple cleanings over time by doing a deep cleaning. It would be really awesome if you guys could wish this guy happy birthday. He's 7 today.
Happy birthday!
Send your waves, send your likes, send your congrats to this guy. He's here traveling with us. He's our little dentist in training. Hopefully he'll be on more Facebook Lives with you guys, but his birthday's today and he's 7.
Woo-hoo.
Yeah. If you guys have more questions, I guess just send them to us. We're here for you. We're here to help.
Comment below.
Comment
Yeah.
below. You know, we'll check the comments. If you guys write us more questions, maybe we'll do another Facebook Live about it and we'll answer them for you.
Yeah, that sounds good. Happy to do it.
All right. Bye, everybody from Denver.